Hi, I'm Dr. Nancy Gill, and welcome to our video series. Today I have my daughter with me, and can you introduce yourself, sweetie?
I'm Ceci, and I'm 4.5.
4.5. So the reason I have Ceci with me today is because we're going to be doing some oral myofunctional therapy exercises. And they are great for adults, but they're even more important for kids. And the reason is that having the tongue on the roof of your mouth is really, really important for proper growth and development, for proper nasal breathing. And because of that, we're going to demonstrate a few of the exercises that you can do at home as a family, or maybe just for the kids before they go to bed at night. Any of it would help to just retrain the brain on where to put the tongue pretty much at all times. So the first exercise we're going to do is called TikToks. And TikToks is one of our favorites. We do it every day. And Ceci's going to demonstrate it for us. So as Ceci demonstrates it, I'm going to just explain what's happening when she does the exercise.
So how you do tick, 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 tock, you have to do one tick, another tick, then one more tick, and then you have to do a talk.
Okay. Can you demonstrate how to do a tick? So as she's doing, keep doing it. So as she's doing it, what's happening is the tongue is pushing on the palate. It's stretching the underside of the tongue. And when she does the talk, it's getting the tongue to the front of the mouth. So the idea is not to have the tongue pushing on the teeth, but
and you
rather...
can't do two talks.
Right.
You have to do one talk.
Just one talk. So the idea is that the tongue is acting as a spacer for the palate and it's stretching it out. Good. We usually do about 20 to 30 of these. Great, good job. So the next one we're going to do is called the granny surprise face. Now the reason why granny surprise is really important is that we have this little space from the underside of our nose to the top of our top lip. It's called the philtrum. And oftentimes when people mouth breathe, this shortens. It kind of makes a little, almost like a little Cupid's bow. And we don't normally get a lip seal when that happens. So we want that upper lip to stretch out and be as long as possible so the person can get a nice lip seal with it. Do you want to do that?
I have to say something.
Oh, sure. What do you have to say about the granny surprise?
There's something called like a stretch.
Mm-hmm.
You have to stretch as far as you can until you have to wait, and then you do it again.
Okay. Do you want to demonstrate the granny surprise face? Okay, let's watch.
So like I keep holding it. I don't let go. It's just that my mom does.
I let go. Yeah. Ceci likes to hold it for 20 to 30 seconds.
Yeah.
Okay, let's demonstrate how it goes. Right, and as far as you can. Good job. And so you can either hold it for 20 to 30 seconds, or you can do it one and then do it.
I was leaving on doing that.
Yes, you often do. Okay, the next one is called Buteyko breathing. And Buteyko breathing, Patrick McCowan lectures on Buteyko breathing all over the world.
It's all about nose.
And it's all about clearing the nose. It's great for allergy season. It's great whenever you feel congested. Whenever you feel like your nose is really clogged up, it's a great exercise to do. Kids or adults, everybody can do them. So how we do that is we breathe in, and then we breathe out of our nose. We hold our nose for as long as you can, and then you let your nose go. And you just try not to open your mouth. If you have to open your mouth because you're a chronic mouth breather, then open your mouth, of course. Eventually, the more you do it, the better you'll get at it. So we're going to breathe in. Can we practice it, see, so we can show everybody? Okay, so we're going to breathe in. We're going to breathe out. And we're going to hold our nose all the way out. And then when we let go, Ceci's going to do it the right way. She's not going to open her mouth. And then we're going to breathe in again. And we're going to breathe out. And we're going to hold it. So follow what Ceci does, not what I'm doing. You shouldn't be talking during it. Good. Perfect. And then she's going to let go. And she's going to do it about 5 times, however long it takes just to feel that rush of air come up the nose. And you can do it as many times as you want. The more allergies you have and the more congested you get, the better it's going to be the more times you do it. And our last one.
I have a question.
Of course.
So when you're done, you can open your mouth.
Oh, of course. Yes, you can open your mouth if you have to, right? We try to always nose breathe, but if we need to open our mouth, we always can. Okay, so the last one is we're going to demonstrate a swallowing exercise. And some people will say, oh my goodness, what does swallowing have to do with anything? Well, the way we swallow started at infancy.
You have to demonstrate it.
In just a second.
So, I have to do it. I have to say something.
Okay, go ahead.
So you have to get your teeth. You have to show them. You have to try to swallow it really hard. And if it goes down your throat, then that's fine. But if it doesn't, then that's okay.
And where's your tongue when you swallow, when you put your teeth together?
On the roof of the mouth.
Right. Can you do it again? Right. Good job. And then you can do that 10 to 15 times. So the reason why it's important is that every time we swallow, if our tongue pushes forward, eventually your teeth are actually going to splay out. They will. It doesn't happen overnight, but over the course of years and years, it will eventually splay out. If your tongue starts to splay across the biting surfaces of the teeth, you'll notice that your teeth aren't level anymore. You'll notice that the back teeth actually are lower as far as a flat plane goes because your tongue is pushing on them. So we don't want that either. So because we swallow so many times a day, we want that tongue to be on the roof of the mouth every time we swallow food and every time we drink a drink. So that's why it's so important. And it started back in infancy, but you can change it. I'm proof that you can change it because I've worked really hard on it and I've been able to do that too. So tongue on the roof of your mouth, teeth together, and swallow. And adults, you can practice that right now, and maybe you already have that method down, which is great. But if you don't, you can always practice it. Easy to do in a car ride, easy to do when you're watching a TV show or something like that. So I want to thank Ceci so much for helping me with this video today. You are such a great helper. Have a high five. And thank you for watching, and continue to watch us for more of our video series. Thanks so much.